I want to focus more on suspensory ligaments, as these are complete game changers. For anybody out there who struggles with bitch spays, I fully sympathize with you, because that was me years ago. And that is the reason for these videos. I have spent years trying to simplify the technique, and I want to pass on to you how I made the procedure simple and safe. For many years, I tried to master the 3-clamp technique, as this was what we were taught at university. I never broke suspensory ligaments and had never been taught a miller's knot. Luckily, I managed to get by. But what broke me was a spay a colleague performed. It came in the following day bleeding from the wound, so I had to open her up, and never had I seen so much blood. The abdomen was full, and as quickly as I removed the blood, it kept on filling. I found the bleed on the left ovarian pedicle, ligated it twice, and luckily the dog survived. But it killed any confidence I had in spaying. I never realized that you could easily kill a dog with a poor ligature, and the amount of blood was unbelievable. The ovarian artery is second to the aorta regards blood pressure. They made it sound simple when they taught us the technique at university, and never warned us of what could go wrong, so I would happily perform a GDV, splenectomy, gastrotomy, enterotomy, diaphragmatic hernia, etc., but be completely terrified of a bitch spay. So how did I make the transformation from being terrified to actually enjoying the challenge of a large, deep-chested, obese bitch spay surgery? 1. As there isn't enough room for 3 clamps, I place 1 clamp and move its position. My choice of clamp is a Carmelt clamp, which holds well and is atraumatic, especially when you compare the forceps to a Rochester peen. 2. I safely break the suspensory ligaments in seconds, which makes the spay far easier to perform. I will focus on the technique after this list. 3. I use miller's knots, as a surgeon's bounces back when the ovarian pedicle is large, and a miller's knot can be made super tight. 4. I separate the uterus. This transforms the exposure and visibility. Initially it feels wrong, but stick with it and you will see the benefits. 5. I check for any potential bleed, when I can easily add in extra ligations, and not when I am hanging onto a thread of the ovarian pedicle, and pulling it back up safely, to add another ligature is a real challenge. 2 useful pieces of advice if a post-spay is dripping blood. If the blood dripping out is clotting, this suggests the source is the skin, fat or muscle, but if there isn't any clotting, then it's likely an internal bleed from a loose ligature. If you go into a bleeding abdomen, check the ovarian pedicles and the uterine. Wherever you can feel the jelly clot, this pinpoints the bleed source. When I used to mentor new graduates, many had been told not to break the suspensory because it's too dangerous. This is wrong. You can easily learn how to break them safely, and in a controlled way. If you don't break them, some spays will get the better of you. Most surgeons start on the right side of the uterus. There are 2 ligaments that run from the ovary. One is the suspensory ligament, with its insertion to the last rib. The other is the renal ligament, obviously running to the kidney. When you go down the suspensory, you can feel the ligament running behind the kidney. In most dogs, only the suspensory goes taut, with the renal going taut after the suspensory is broken. In a very few, the renal ligament can be taut and not the suspensory. This means you can't break the suspensory. When you get more advanced, you can gently rub the renal to loosen a little, but don't try this yet. In most dogs, only the suspensory goes taut, with the renal going taut after the suspensory is broken. In a very few, the renal ligament can be taut and not the suspensory. This means you can't break the suspensory. When you get more advanced, you can gently rub the renal to loosen a little, but don't try this yet. If you break the renal ligament, you often get bleeding at the ovarian insertion. Don't panic. All this means you have to be extra safe. Before, when you pulled on the ovary, the ligaments would take the strain, but if both ligaments are broken, pulling on the ovary will. Now pull on the vessels. The only time I don't break the suspensory ligament is when the patient is an old, obese dog. In these dogs, both suspensory and renal ligaments break very easily, so if you break the suspensory, the renal will probably just follow. In the 100 bitch spays, you will see how my technique changes. The dog's left suspensory is more difficult to break, as it is much thicker than the right, about 2 to 3 times more so. Just recently, I feel I have now found the best technique to break this suspensory. You can try pushing down or push the ligament laterally, which can result in breaking the ligament by 2 halves. Break the left suspensory by following it to its insertion, using your left index finger. Then hook your finger under the suspensory and push upwards. The advantages are: this is done in a few seconds, but more importantly, the suspensory breaks cleanly. At the rib insertion, sulfur monoxide, there isn't any damage to the ovary.